So let's round out Chapter 11, Unit 2, and we'll go from here. Behavioral disorders. So as we're looking at behavior disorders, there's the fluoxetine, paroxetine, sertraline. We've already talked about these because they're behavioral disorders, but they're also mood enhancers, right? Your antidepressants. So keep in mind that the same things are that we've already learned, we're just using it for a different therapeutic outcome. And what's great about practicing nursing for you is that we're looking at what our patient needs. And so as we look for these drugs that are for behavioral disorders, you might see weight loss early, but then later on you might have that weight gain. So we're going to help patients with that. Don't ever forget about sex, because you can have sexual disorders, and these patients need to be able to work through those things. In addition, remember there's that thing of suicide precautions, that these patients initially don't feel good. It takes weeks for it to become therapeutic to make them feel great, but halfway between, they still don't feel good, but they have energy, and so they're more of a suicide risk. So we want to make sure that these patients are safe and that they're able to to not be a risk to themselves or others, obviously. So remember, fluoxetine can also displace your warfarin. So we're going to monitor the PT and INR times of these patients that are on warfarin. So just look at those basic things that it really will your patient needs to know in order to get their best therapeutic outcome. CNS, your lethargy is something with these types of drugs. We're always watching for dizziness, confusion, lethargy, those types of things. We want to make sure that those are not things that happen to our patients. So that's really Chapter 11. Let's get into Chapter 12. Just toggling forward a bit. Chapter 12 takes us to substance abuse. And when you get to mental health, you're going to learn more about substance abuse and withdrawal. There's CWA orders and things like that. Remember that withdrawal can be life-threatening. Alcohol withdrawal, I think about specifically. And so we're trying to monitor the adverse effects, and we're going to keep that diazepam or that lorazepam on board, not only because seizures are a risk, because you already learned that those benzodiazepines stop seizures, but they're also going to decrease the anxiety for these patients who are withdrawing. So keep in mind that we want to make sure these patients withdraw safely, and sometimes we'll substitute, for example, for heroin, we're going to substitute with methadone, and you all have learned that pretty good. So substance abuse, just by nature, knowing that we need to keep our patients safe. Chronic neurological disorders, I think about myasthenia gravis. Tensilon is the name brand. But those types of drugs, Mestinon, we don't use them quite as much in practice. However, what you just need to be familiar with, those drugs are for myasthenia gravis, and so we want to make sure that the patient is made therapeutic again. But more importantly, in this category of drugs are your carbidopa, levodopas for Parkinson's disease. And as a neuro nurse, many of you know that I do have a neuro background, a neuroscience background, is our carbidopa, levodopa has to be administered on time. I've seen a patient where they came into the hospital from home. That drug was profiled differently from the timing that was in the hospital, and she ended up in a catatonic state. So we need to make sure that we give it at the time that's appropriate for our patient. And when a patient comes in the hospital, sometimes our drugs are given at different times when they take them at home. And so you've all heard there's that golden window, half an hour before, half an hour after, to give drugs to patients. With your clinical instructors, we might stretch it to an hour before, an hour after, depending on the drug. So when you get your patient, you're going to get in the practice of prioritizing which patient has the most important drugs. And if you have me in clinical, I'm going to have all 8 of you who are in front of me passing medicines. I'm going to look at your drug list to determine what are the most important ones that we have to have on time. My Parkinson's drugs will always be that on time. My blood pressure drugs I'm going to monitor early. Heart drugs, I'm going to do the same thing. So keep in mind that some drugs have to be on time, and that's one of them, carbidopa, levodopa. Huge, huge, huge. And so you'll be dealing with that for the rest of your life. Now, anti-epileptics, we've already talked about that a little bit, right? We know that benzodiazepines stop status epilepticus. Yesterday, in the first video, I talked pretty much about phenytoin and the need to measure your levels in phenytoin, your valproic acid, and those types of things. So the goal is to decrease seizures. So that is the end of anti-seizures, and I'm now learning that I need to stop at about the 5-minute mark in order to make sure it doesn't get thrown out. So here we go.